Today, I'm joined by Christina Cahill-Longo, a passionate ASHA certified pediatric speech language pathologist and orofacial myologist with 13 years of dedicated experience. Christina is also proficient in American Sign Language. As a proud graduate of Nova Southeastern University, she seamlessly transitioned from an acute medical setting, including the NICU and trachs and vents, to a private school setting. She helped spearhead the launch of the Student Services Department for her school to include speech services, literacy, and math intervention. During the summer, she runs intensive speech therapy sessions, a literacy camp, and language building through playgroups. As a devoted mother of three, she understands the intricate balance of parenthood and the importance of accessible therapy. Her journey in the field of speech therapy took a personal turn when her twin boys faced speech and language delays, sparking her commitment to advocacy and inclusion for all her clients. Then she set out on a personal quest for knowledge after her daughter's orthodontic diagnosis revealed orofacial concerns that led her to establish Verge Therapy. Christina, thank you so much for coming today.
Thank you. Thank you. I'm super excited to be here and I appreciate you having me on today.
So, does that cover everything, or is there anything else you want to add before we talk about your private practice?
I think that does cover everything. I think my center of everything I do is the motivation and the inspiration of my clients and making sure that their needs are met, not just speech language needs, but their emotional needs as well, and letting them know that they're capable of all things. I mean, that's pretty much where I'm coming from for my practice.
I love that. And I bet your personal experience adds to that too.
Mhm. It does a lot.
So, how did you transition from the medical setting to a school based private practice setting? And what is your perspective on advocacy for your clients?
Yeah, so I was in the hospital setting and it's all I wanted for a really long time. And it was everything. I was so excited to be in the NICU and the trachs and the vents. And then I ended up having my daughter, and it was just very overwhelming to be in that type of environment. And the older she got, the more I wanted to be part of her life. And when you're in the hospital, you don't get weekends off and you don't get Christmas off or, those things. And so I was really blessed to end up having someone ask me if I wanted to work in a private school. And if I worked in the private school, then my daughter could be part of the private school and I would have her same schedule. And that's how that all sparked into working in a private school. But then when I went into the private school, it reminded me of my childhood. So when I was younger, I was also in a private school and I had dyslexia and a learning disability. They didn't know what it was at that time. And they said, I can't help you. You need to leave this school. And can you imagine you're like in third grade and has been your school this whole time and you have to go out of this environment to a public school. It was very overwhelming, and they just kinda pushed me off to the side and put me in special classes, and I always felt like I was never good enough after that experience. So when I came to the school, they had no speech therapist, they had no type of accommodations for any students, and they basically would say, "Well, they can't cut it here," and do the same thing. And here we are in 2020. You can't do that. You can't tell children they don't belong. So that really was the catalyst for me starting a reading intervention program and a math intervention program and just building up the student services so that they were able to have a place where they can come and learn and try to catch up and fill those holes and feel accepted and feel loved in an environment that they're currently used to, instead of having to go out and try to figure out an IEP and get back into a public school setting. And I love it because it allows me to say, no, this child belongs here. We just need to give them a couple of accommodations and they'll thrive.
I love that.
Yeah.
That's amazing. Yeah, I completely agree with you. I feel like that not only is it the academic aspect, but the social aspect too. These children form friendships, the parents form friendships, and then I imagine there's a lot of shame that goes along with you don't belong here. It's too academically challenging. You do better in this type of setting. We don't provide accommodations.
Yes. Yes. And I think that also leads to parental expectations, right? We all have these expectations where our children are going to thrive and they're going to be on the honor roll and they're going to be on the presidential roll. And that's not fair to put that expectation on every child. And when you're surrounded with all of these kids who are meeting those expectations, as a parent, you feel defeated that your child's not. And then you're in a school where they're saying, well, your child's not. And then your child is, it's like a domino effect. And it's my whole heart is to tell the parents this is not for the rest of their lives. We just need to figure out how we get them to show their potential, how we get them to be successful in this environment to what their success is. So it's also advocating for the parents too and helping them to realize, okay, my child doesn't have to be on the A honor roll for them to be successful. They don't have to be, making all of the AR points, the reading points. They don't have to be successful in math. They can really thrive in this environment. And maybe they're person smart and they're really good at building friendships. And so that's what we're going to focus on. And maybe they would thrive in art and not just, oh my gosh, they have to be the A student and they're going to be engineers and scientists. And who says they're not? But let's accept them for who they are right now.
Yeah. I love that you're like helping parents just look at it a different way too.
Hmm.
That if they don't
Hmm.
fit like this mold of what the student should be like, it doesn't mean there's anything necessarily wrong with their child and they can still be successful.
Yeah.
So, what does the intervention programs look like that you've established at this school?
So I have two types of reading intervention, and we do a lot of testing for that to figure out where they are in their reading skills. And then what we do is very small groups that cater towards where their holes are in their reading. So either it's an intensive reading program where they come to us for an hour every day and we're filling those gaps and holes. We do a lot of Seeing Stars by Linda Mood Bell. We do the 98% group. And then really working on making sure they can decode and they have fluency and that they are able to be in their classroom environment and meet the requirements. And then there's some kids that are not so far behind, but they kind of need that little bit of a push. So they come to me 3 days a week for 30 minutes. So that would be the reading. And the same thing for the math. We do the same exact thing in the sense that if they are struggling and they have really big holes, they're coming to me for an hour every day. And we're focusing only on math and we're doing it for concepts that are, those abstract concepts that they can't figure out to also the memorization of those fundamental math skills that we just need to know to do it faster. And if you're doing well in that, you just need a little bit of extra help. I have people who come and do the 30 minutes for 3 days a week. That's what the reading and the math intervention looks like. And then during the summer, we have these summer slides. So you get these kids back up to where they need to be, and then they go on vacation and they have so much fun and they learn that fun is great, but they also forget like 3 months of all of that hard work. So for the summer, I do intensive reading, but it's 2 hours, 3 days a week. And it's really like sensory integrated. So we're jumping and we're running and we're putting it in shaving cream and we're playing with glitter and sandpaper and we're going around the room finding things. And it's amazing how that little bit of time, it doesn't sound like a lot, 2 hours a day for 3 days a week for that summer. You're maintaining what they have already established and they're growing and they come into the classroom and they're ready in comparison to all those kids who didn't read during the summer, who didn't apply during the summer, which we normally don't because you're talking about regular thriving students who don't have those academic issues. The parents aren't always pushing for that. And you pushed for it all summer. So they come back feeling pretty great about themselves because their reading is further along than the kids who are already there and didn't do anything over the summer.
Yeah. No, that's awesome. Are the parents paying for this or is the school paying you for this?
No, the parents pay for it.
Okay. So it's
Hmm.
like
It's
extra.
an added, like after school. It's the same thing as you sign up for summer camp. So you would sign up for a reading intervention instead of summer camp. Where I hold it, if you decide to do the camp for the school, because I have it at the school, but anyone can come. It doesn't have to be the school. But if you sign up for the school summer camp, they'll prorate that time that you missed when you came to me. And
Mhm.
then you can also be part of the summer camp as well. But it's just a regular summer camp. And I have lots of students who only come to just that 3 days a week, and then they go off and have fun for the rest of the summer.
That's awesome. What's
Mhm.
like the youngest that you see? What is the typical age range?
So I usually say kindergarten through 5th grade. And I do have a lot of kindergartners that end up coming so that the parents feel like they're ready for 1st grade. But I do also get a ton of, we're going into middle school and I just want to make sure my kids are ready. And then I have a little bit of a trickle in the middle.
Okay, awesome.
Mhm.
So you talked about your children's diagnoses. How has that impacted the way you provide services for your families?
So, as a speech therapist, I'm sure you know you love your kids and you want the best for your kids. And we never stop thinking, right, about, well, what could we do differently and how can we target that differently? But then being on the other side of the table really changed how I approach everything. It changed how I see the child. Sending your child to school and they don't have any words yet is really nerve wracking. And you don't think about that when it's not something you've experienced. We know as speech therapists that our children have difficulty communicating and they need their AAC device, or they're going to use sign language, however it is, or their words are going to be broken. We know that and we're going to put supports in place, but the fear that a parent has and the anxiety that a parent has, I never really understood until my twin boys were not talking and I kept having to leave them so that I could work. So it really changed the way I approached my families and the way I delivered my services, because it became more not just speech therapy but also emotional support as well, in the fact that I stood in your shoes. I know, not to the extent of severe, but to the extent of, in this moment my child's not communicating, and how I feel about that, if that makes sense.
Yeah, no, that totally makes sense. Thank you for sharing about that and your personal experience.
Mhm.
So, how did your journey start with myotherapy?
My daughter, so on top of my twin boys having all of these speech and language issues and needing feeding therapy and occupational therapy, my daughter's jaw was not aligned. She had a crossbite. And every time we went to the dentist, they would tell me, she has a crossbite and she's going to eventually need some orthodontic intervention. And your boys have crossbites and they're going to eventually need orthodontic intervention. And they never said anything about myotherapy or, that I'm capable of altering that now. They just kept saying, we're going to watch it. We're going to wait. We're going to watch it. We're going to wait. And they're going to need orthodontic intervention. And I ended up taking her to the orthodontist and they did that very nice free consultation, panoramic view and the teeth. And oh, well, her crossbite, she has a low tongue posture, but she's never had a lisp. And she has a reverse swallow. And I've never seen this reverse swallow happen. So I looked at them kind of like they were crazy. And they said, she's going to need a speech therapist after this. I said, well, I am a speech therapist. And they're like, no, one who does myofunctional therapy. And what? What's that? What do you mean, myofunctional therapy? So they say, oh, well, they're very hard to find. And there's only two in Broward that we know of. And that's what she's going to need. So this was the catalyst to, I have to go and figure this out. How can I be a speech therapist and not be able to help my children? Like all three of them. How do I not help them? So I ended up researching a lot about myofunctional therapy and what that means. And we moved ahead with the palatal expander for my daughter, and it was life changing for her. And kind of broke me a little bit to know that if I had known that she had a reverse swallow and a low tongue posture, I could have helped her
Mm.
because now she has all of this orthodontic structure in place. She's breathing better. She feels better. She's sleeping better. She's not as congested. If I had known all three of my kids had trouble sleeping and they have the crossbite, and all of them suffered from sinuses and they all had the crossbite, none of that was said to me. They just kept saying, "Oh, we're going to send them to the orthodontist." And I, as a speech therapist, didn't know. This blew my mind that I could have somehow helped, but didn't know what that meant.
Mhm.
So then I went and started taking classes and more classes, hours. I have over 70 hours of training at this point of just myofunction. And, like how to not just myofunctional therapy, but how to help my children across the board. That's how it started.
Yeah. I love that. Uh,
Yeah.
so we live close to each other. We were talking about this before we got started, and I can definitely attest that it's really hard to find myofunctional therapists in our area.
Yeah.
I don't know if a lot of people know this because I haven't actually mentioned it on the podcast or on my Instagram a lot, but my daughter did, I'm happy to say, suck her thumb. She's 3.5 years old. And we tried, eliminating it. I don't know if that's the right word for 4 times. This is the fourth.
Mhm.
And I had taken a course before, but it wasn't really thorough. But then I took the one from Simon Says, which you mentioned is where you've taken a lot of your courses from. And
Mhm.
I really liked it, and it seems to have really helped. It seems to be sticking. We're on day 30 now, and it's just amazing. But I'm so worried about the spontaneous recovery, especially when it comes to new environments. Like school's going to be ending soon. We'll be starting a new class. But I think what I'll do, because I've also talked to a behavior therapist about this, is just re-implement the system
Yes.
when that new environment pops up. So we'll just
Mhm.
do like maybe we won't do 30 days, but maybe we'll do like 15 instead.
Mhm.
Just very, very positive. But I do want to follow up with a myofunctional therapist. So we'll be definitely talking after this because
I would
I
love
make
that.
sure everything's going well. But I can tell you, I've been taking pictures, and my husband and I both noticed a drastic difference. And like you, the dentist is not really concerned. The pediatrician is not really concerned.
Mhm.
They should be concerned. There was a clear overbite. Like, there was a clear I have pictures of it. And now that we've stopped and I've been using the Myo Munchie,
Yes.
like, you would never even know. You would never know how that she used to suck her thumb. Her palate was so high. It was like a literal thumbprint up there.
Yes.
He did it all day long too. So there was not a lot of room for the teeth to readjust. And the fact that she's not doing it for 30 days and we're just seeing such a drastic change really goes to show that it is so important for that early intervention.
Yes. I 100% agree with you. I have a lot of parents ask, when is the right age? And that's so hard to say because there's a comfort factor to that too, right? There's a reason they're doing that. It's comforting, but it's also providing that stimulation to the palate because they're not putting their tongue up there. And now it's so high. So, really, that thumb sucking program, they say you shouldn't start until 4.
Yeah.
But I've actually started with 2-year-olds
Okay.
and not like we're going to eliminate it, but that all day sucking is creating that volted palate. And if we could get rid of it during the day and get rid of it while we're watching TV and get rid of it while we're playing, because they walk around playing like that, at least we're giving the palate time to come down and then we'll try it again. So that way, that next round, like you're saying, we're just reinforcing not doing it and we're getting the results without having to go through all of that orthodontic intervention. And it is, to me, that's life changing because now if you do orthodontic, and not to say that you shouldn't, right? There's always a need for it. And if that's what is expected and needed, then we need to do that. But at 3.5, you're changing her whole trajectory by just saying, okay, let's do this little take your thumb out, the myo munchie. If I had known that for my daughter, she probably wouldn't have needed the palate expander and the braces, and she would have had enough room for the teeth to come down, and that was the big issue, exactly what you're saying is she did not have room for her teeth to come in.
Yeah. So she didn't suck her thumb, right?
She was a passy girl, and
Oh.
everything was a pacifier, and I felt like we got rid of it in enough time, but it obviously all 3 of my kids were pacifier babies,
Oh.
and my I wanna say I eliminated it, but my mom also loves her grandchildren, so she would hide them around the house. So if I was not home, they were allowed to have a pacifier. So I think that did contribute to a lot of those issues. Mm,
Yeah. I think being speech language pathologist, personally, I carried a lot of guilt. I actually
mhm.
had to mute some accounts that talked about it too much because it's like balancing being supportive of your child and what they'd like to do and what comforts them, but also knowing the ramifications of that.
And
And like you said, just finding a good time to approach it. And I know the program said 4. I felt like cognitively she could handle the conversation of the why now.
mhm,
I do feel like she could handle it when she was around when we started it before, but I didn't know the right tools to use until seeing this program. So like
yeah,
before we were covering it with gloves, and I'm sure you've seen that, the clear block.
yeah,
And then I love her program because it's not covering it all except for the nighttime for the first week. So it's like really she has to make the conscious choice. And I do think there's an age for that. But yeah, it's hard. It's really hard to know to balance both of those. But
mhm,
and then I'll have people who judge me now for even stopping it. Like, oh, it would have been totally fine if she did it till she was 8. And I'm like, well, it wouldn't
right,
because I guess I'm trying to think of it in a way, like, I don't know if you have a good explanation of something. I think like potty training, right? Like potty training is hard. It's very hard. And yeah, my child could wear a diaper until she's 8 and go to sleepovers with a diaper.
mhm,
But why would we do that to her? Because there's like ramifications for that, like the social aspect of wearing it, of wetting the bed. So why not do the hard work now together, like in a supportive way?
yes. I 100% agree with you, and I think it's like anything else, right? The more education is out there and the more you get them to understand that I'm not trying to take away their comfort, and I'm going to love on them still, and we are still providing ways for them to have that comfort, right? So, in that program for Simon Says, you do a lot of stimulation to the palate,
Mhm.
right? So I'm still providing the comfort, I'm just giving it to them in a different way.
Right.
And I think when you take the thumb away, you're making a child grow up, but I'm not. They're still a baby. They're still going to get a ton of love, and I think that's where you have to just advocate, right? That's our job is to advocate and to educate because there's so many people who, like you said, do that same thing, that back and forth. And I love your example. You are 100% right. I wouldn't let my child walk around in diapers. So why would you allow your 10-year-old to continue to suck their thumb?
Yeah.
Mhm.
Yeah.
Y
And, whatever anybody chooses, that's their choice. This is
Yes.
mine, so I'd like to not be judged for it, and I'm sure you're
Yeah.
the same way, right?
Yes.
Yeah.
I 100% agree with you. And you're doing it because you love your child and you know that she's gonna benefit from that in the long run,
Yeah,
right?
yeah, the way she is so proud of it, it
Yeah.
says a lot.
Yeah.
So
I'm very proud of her.
oh.
I would give her a prize if I could.
So many praise. I will say it's a very expensive habit to break.
Especially if you do that. Yes, and you
Yeah.
do the chart and yes,
I
all
think
the prizes.
if you do this with clients, which I've thought about maybe trying it with some people, I've thought about, like, having 2 options where the parents give me a lump sum, I buy things for them, or it's almost like a rental basis. I'll just reuse the stuff that I gave my daughter, like, package
Here's the
it,
fidget. Yeah,
care about the toys after, like, a week or 2 weeks, you know?
true.
Yeah.
That's smart. That's smart. I normally have the parents buy everything because they're very familiar with their child and what their child's gonna like, and I wanna be able to implement it where they're gonna be invested in it,
Yeah, that's
but I can see how it would be beneficial for me to just go out and buy everything and
yeah,
just say,
see the
"Oh, look
norm.
at these fun things," right? I think it all depends on the child. I have one child who did not care a lick about stickers. Not a li right? So, that was not helpful, we had to come up with a whole other way. So, we did high fives and praises, and hugs. And that's what she wants. She doesn't want those stickers. She doesn't care. So we have to do a whole other thing. And so that makes me, and the fidget toys, nothing to do with the fidget toys. And her hardest part is being in the car. So instead of sucking her thumb, we're blowing bubbles out the window and we're waving like a princess. So I don't think any one child fits into that mold, but I do like your idea. I might steal
Go ahead.
it. I'm just kidding.
I do feel like those elements might have been the hardest part when Liv was younger. She used to not care about the reward system and she wouldn't have cared about the fidget. Now that she's older, it
Right.
was easier. So yeah, there's certain things that had to fall in place. I think just because we've tried it so much, I can see why they maybe recommend 4 too.
Yes.
Like,
Yes. But I do think it's a great program when it works. It's life changing.
yeah. So tell me, why are you so passionate about incorporating a growth mindset into every one of your sessions?
Yes. Okay. So I'm a big advocate for growth mindset because it all stems back to my childhood and not really getting that feedback of you're doing a great job, right? It was very everything, especially in a school base, especially with young children. You really are so honed in on what your peers are doing, right? So for a school setting, 6th grade is reading The Hatchet, but I can't read The Hatchet. I can't. I can't even get past simple reading passage. I'm not going to focus on the fact that you can't read The Hatchet. I'm going to tell you that like you're an incredible child and you are worthy of so much more than just reading The Hatchet. And what are things that you enjoy and what are things that you like? Let's focus on that. I want to control who they see themselves out and who they see themselves as because identity really leads to how we think and how we act. So I hone in on, man, I love that you made a mistake because you made a mistake. We're going to learn from it together. I love that we're struggling with this because we're struggling with this. We're going to conquer it together and we're going to be so much better at the end for this. And I try to get my parents to buy into that. I want them to make mistakes in front of their kids. I want them to see that we are not perfect and that we are going to show resilience. So, not in a moment where we're practicing and I'm saying the word wrong so that you can identify auditorily that the word was wrong, but that I made a mistake. Oh man, I made a mistake over here and I have to fix it. And I'm not perfect. So that they can see that they don't have to be perfect. I just feel like if we can let children know that there's so much more to them than their language, than their reading, than their math skills, that we would create some incredible children who are going to impact the world in different ways, not just because they got on the A honor roll. And I think that that's how my whole session focuses a lot on who they can be because of who they are and not just we have to perfect this and fix it so you can be like everyone else.
Yeah. It seems like in our society, a lot of it is achievement based, whether it's academic, whether it's sports related. And, I think we try to applaud children for doing the right thing or the kind thing, but there's not enough emphasis placed on it or on like other strengths, as you
Right.
mentioned. And
Yeah. So I really try very hard to find another smart that they have and I try to give them that smart. So, like you're art smart. Look how good you do this art. You are so creative. Or you're people smart. You're so good at making friends and you can tell when your friend is down and I love that. Or you're think smart. I love how you problem solve that. That was pretty cool. So that they can find value in themselves. It's not just academically driven. And I also want them to have a growth mindset so that when they advocate for themselves, they don't feel bad about it. Like my boys are diagnosed with ADHD, and at first I didn't want them to know, right? So I'm sorry your mom gave that to you, but I'm not going to tell you about it. They need to know. They need to know, like, I'm really cool and my brain goes super fast, but I create amazing comics. I'm very visually smart. I'm very art smart. And I just need you to tell me again. I need that for my kids. And so I can imagine that parents need that for their kids too. And if I can't show you how cool you are, then it makes it hard to advocate for yourself and not feel like, oh man, I can't do those things, you know?
Yeah. I love that so much, and I'm gonna take that from you. And I'm try to do something like that with my clients, my daughter. I like the different kind of smarts that you point out in children. I
Yeah,
love
I love that too. And actually, I don't know if you follow Kathy Coach. I think it's Coach. She's actually has a great book that talks a lot about different smarts and how we shouldn't have perfect kids and how to talk to your kids about the different smarts that they have. And so I take a lot of philosophy from her too. Not just I think it resonates very much with me. And I feel like if I had had more of that, I wouldn't have had to work so hard for the confidence I have today, right? Maybe I would have conquered the world by now
Mhm.
instead of having to find myself through all of these journeys, which is good because it's helping me, advocate for my kids now.
Yeah.
But I think we can create some pretty great kids if we just show them that there's different smarts and not just the smarts that the society expects for them.
Yeah, that makes sense.
Mhm.
Oh, Christina, this has been amazing. Is there anything else you want to add before we wrap up today?
Oh my gosh, it's over. It happened so fast. I love talking with you. Thank you so much. That you can follow me
Perfect.
on at verge.therapy on Instagram, and I'm in Broward area. If you need anything, I'm more than happy to help you. And I absolutely loved talking with you today.
I loved it too, and I will definitely be talking to you more. I'm super interested in everything that you're doing. Christina, this has been great. Thank you again.
Thank you too.